Hi, I'm Jennie Pollock. I'm Head of Public Policy at the Christian Medical Fellowship.
Hi, I'm Gillian and I work for Our Duty of Care, which is a campaign of healthcare professionals against assisted suicide and euthanasia.
Great. Thanks so much for joining me today, Gillian. I just wanted to chat to you quickly about the consultation that's been launched about the assisted dying bill in Scotland. Can you explain what it is and what a consultation is?
Yes, thank you so much for having me. Liam MacArthur is the MSP for Orkney, and he has proposed that he will bring forth a bill to the Scottish Parliament, to Holyrood, to bring in assisted suicide for the terminally ill next year. And so what he's done before that is launched what's called a consultation. And it's really an opportunity for anyone to contribute what they think about the topic. And anyone can click on the link which he has set up and give their two pennyworth about what they think. And then all the responses will be reviewed between January and March, and then it's likely there will be a bill probably next May, June time.
Great. So a consultation might sound like quite an intimidating thing for anyone that's never done it, particularly if you start to read his paperwork. It's got about 30 or 40 pages of information. Is this going to be a huge thing that's going to suck everybody's time? Is it difficult to do?
It doesn't need to be. I think what I would really encourage people is that there are boxes that you can tick. So it's simply asking the question, are you in favour or opposed to the introduction of assisted suicide? So that's when the doctor gives a lethal dose of the medicine to the patient and they take them voluntarily. It's not palliative care, it's not withdrawal of treatment, and it's not do not resuscitate. It is the act of giving medicine to a patient to help them commit suicide. So if you're in favour or against, you can fill in the box and tick that. And if you're able to give a reason, then that's great, and you can fill in the free text box. But if you're not, then just go on to the next box. So there's several questions, but it doesn't need to take lots of time. We'd just be really glad if lots of people can just put in how they feel about this particular issue. Thank you.
Brilliant. And we're particularly asking doctors and nurses, particularly for this one. This is the first time we've specifically reached out to nurses to ask them, because the bill makes it clear that nurses will have an involvement. Obviously, nurses have a much greater involvement with their patients than doctors often. So you'll be on the front line and really seeing patients coming up to make these decisions.
Absolutely, and I think it will affect medicine. It will affect the whole culture of looking after people, having to tell people that this is an option, that they can choose to take their own life, will change end-of-life conversations. And so nurses are so involved with patient care and know their patients really well. So I would really ask that nurses have an important voice to contribute, and that we do ask that they do come forward.
Yeah, fantastic. Sorry if you can hear a bit of background noise. It's Gillian's dog. She's got a new dog and he's enjoying chewing on his chew toy, I think. So yeah, we just wanted to make this little video just to reassure you that it's a really easy thing, and it is really important for your voice to be heard. As Gillian said, even if all you do is tick the boxes, it's better to get lots of responses with people showing their opposition to assisted suicide than it is to have just a few sort of long academic, fully referenced text like we at CMF do, like ODOC does.
Yeah, absolutely. Yeah. I think really like the spread, and it's really important that the people who are working on the wards, the individuals, not people in offices writing policy documents, the people on the wards who will have to be part of this procedure, you really want to know what you think. So it's really important, and that's what they've asked for. You know, that the MSPs have asked for the members of the public, and in this situation, doctors and nurses, allied healthcare professionals really know the most about this. So please do respond.
Great. The closing date is the 22nd of December. So we'll put up the links. We're sending this out to you with some resources you can use to help you fill in your response, and really encourage you to do that, and ask you to ask your colleagues to as well, if you would be able to. So that's 22nd of December, fill in the consultation. Thank you so much.
Many thanks.